1. A patient prescribed carbamazepine reports bruising and frequent nosebleeds. What should the nurse do? Answer: notify the provider and assess for signs of bone marrow suppression. Rationale: carbamazepine can cause aplastic anemia, which may present as bruising, bleeding, and infection. 2. A nurse is caring for a patient on amitriptyline who reports blurry vision and constipation. What is the nurse's best response? Answer: educate the patient that these are expected anticholinergic side effects. Rationale: amitriptyline, a tricyclic antidepressant, has strong anticholinergic effects, including dry mouth, constipation, and blurred vision. 3. A patient taking propranolol complains of shortness of breath during light activity. What is the nurse's priority action? Answer: assess respiratory status and notify the provider. Rationale: propranolol is a non-selective beta blocker that can cause bronchospasm, especially in patients with asthma or COPD. 4. A nurse is administering vancomycin. What is the critical parameter to monitor during administration? Answer: monitor for signs of red man syndrome and adjust infusion rate accordingly. Rationale: rapid vancomycin infusion can cause histamine release, leading to flushing and hypotension. 5. A patient prescribed levothyroxine for hypothyroidism has a heart rate of 120 beats per minute. What is the nurse's action? Answer: hold the medication and notify the provider. Rationale: tachycardia suggests levothyroxine overdose, which can lead to serious cardiac complications. 6. A patient reports severe diarrhea after starting colchicine for gout. What should the nurse do? Answer: notify the provider to evaluate for colchicine toxicity. Rationale: diarrhea is an early sign of colchicine toxicity, which can be serious and requires prompt management. 7. A nurse is assessing a patient on doxycycline who develops a sunburn after minimal sun exposure. What teaching is necessary? Answer: instruct the patient to use sun protection and limit sun exposure. Rationale: doxycycline increases photosensitivity, making patients more prone to sunburns. 8. A patient taking sertraline reports new-onset suicidal thoughts. What is the nurse's immediate action? Answer: notify the provider and ensure patient safety. Rationale: SSRIs like sertraline can initially increase suicidal ideation, especially in young adults. Immediate intervention is required. 9. A nurse is administering heparin and notices bruising and petechiae. What should the nurse assess next? Answer: check platelet count for signs of heparin-induced thrombocytopenia. Rationale: HIT is a serious immune reaction to heparin that lowers platelet count and increases clotting risk. 10. A patient on fluoxetine reports agitation, confusion, and muscle rigidity. What is the nurse's priority? Answer: suspect serotonin syndrome and notify the provider immediately. Rationale: fluoxetine can cause serotonin syndrome, a potentially fatal condition requiring urgent medical attention. 11. A nurse is caring for a patient on azathioprine. Which laboratory finding is most concerning? Answer: decreased white blood cell count. Rationale: azathioprine suppresses the immune system and can cause leukopenia, increasing infection risk. 12. A patient prescribed niacin for hyperlipidemia complains of facial flushing. What is the appropriate nursing intervention? Answer: inform the patient that flushing is common and may diminish over time. Rationale: flushing is a harmless but common side effect of niacin and typically lessens with continued use or aspirin premedication. 13. A nurse administers ondansetron to a postoperative patient. Which adverse effect must the nurse monitor for? Answer: prolonged QT interval. Rationale: ondansetron can prolong the QT interval, increasing the risk of serious arrhythmias. 14. A patient on potassium chloride tablets reports abdominal pain and black, tarry stools. What is the nurse's best response? Answer: notify the provider immediately and hold further doses. Rationale: oral potassium can cause gastrointestinal ulceration and bleeding, requiring urgent evaluation. 15. A nurse is reviewing a patient's medication list. and notes concurrent use of sildenafil and nitroglycerin. What is the priority action? Answer: notify the provider immediately and hold the medications. Rationale: concurrent use can cause life-threatening hypotension and must be avoided. 16. A patient receiving chemotherapy with doxorubicin develops shortness of breath. What is the nurse's next action? Answer: assess for signs of cardiotoxicity and notify the provider. Rationale: doxorubicin can cause cumulative dose-dependent cardiotoxicity, presenting as heart failure symptoms. 17. A patient prescribed prazosin for hypertension experiences the first dose at bedtime and becomes dizzy. What is the nurse's teaching point? Answer: advise the patient that first dose orthostatic hypotension is common and to rise slowly. Rationale: prazosin can cause significant blood pressure drops with the first dose, necessitating safety precautions. 18. A nurse is preparing to administer phenytoin. What safety measure must be followed? Answer: infuse slowly to prevent hypotension and cardiac arrhythmias. Rationale: rapid infusion of phenytoin can cause cardiovascular collapse. Therefore, it must be given slowly and carefully. 19. A patient taking tamoxifen for breast cancer prevention reports abnormal vaginal bleeding. What should the nurse do? Answer: notify the provider immediately to rule out endometrial cancer. Rationale: tamoxifen increases the risk of endometrial cancer. Abnormal bleeding requires immediate investigation. 20. A nurse reviews orders for a patient prescribed sulfasalazine for ulcerative colitis. What side effect requires patient education? Answer: possible urine and skin turning an orange-yellow color. Rationale: sulfasalazine can discolor bodily fluids. It is harmless, but important to warn patients to prevent alarm. 21. A patient receiving clopidogrel reports black, tarry stools. What is the nurse's priority action? Answer: notify the provider immediately and assess for gastrointestinal bleeding. Rationale: clopidogrel increases bleeding risk and black, tarry stools suggest upper GI bleeding requiring urgent evaluation. 22. A patient taking lithium complains of excessive thirst and frequent urination. What is the most appropriate nursing action? Answer: assess for signs of lithium toxicity and check serum lithium levels. Rationale: polyuria and polydipsia may indicate lithium-induced diabetes insipidus or toxicity. 23. A nurse is administering gentamicin. Which laboratory result requires immediate attention? Answer: elevated creatinine level. Rationale: gentamicin is nephrotoxic. Increased creatinine levels indicate impaired kidney function. 24. A patient on warfarin has an INR of 6.5. What is the nurse's immediate action? Answer: hold the next dose and notify the provider. Rationale: an INR above therapeutic range increases bleeding risk and requires provider intervention. 25. A patient receiving amiodarone develops a cough and shortness of breath. What should the nurse do first? Answer: assess respiratory status and notify the provider. Rationale: amiodarone can cause pulmonary toxicity, requiring early detection to prevent respiratory failure. 26. A nurse notices a patient taking digoxin has a heart rate of 50 beats per minute. What is the correct action? Answer: hold the medication and notify the provider. Rationale: digoxin can cause bradycardia, and administration should be withheld if heart rate is too low. 27. A patient on bupropion for depression reports a recent seizure. What is the nurse's priority action? Answer: notify the provider and discontinue the medication. Rationale: bupropion lowers seizure threshold and should be discontinued if seizures occur. 28. A patient prescribed metformin develops confusion and rapid breathing after a contrast study. What is the nurse's immediate concern? Answer: suspect lactic acidosis and notify the provider urgently. Rationale: metformin combined with contrast dye can precipitate lactic acidosis, a medical emergency. 29. A patient taking furosemide becomes dizzy when getting out of bed. What should the nurse prioritize? Answer: educate on orthostatic precautions and monitor for volume depletion. Rationale: furosemide causes fluid loss leading to hypotension and dizziness. Safety measures are necessary. 30. A nurse prepares to administer epoetin alpha. What laboratory result must be reviewed before administration? Answer: hemoglobin level. Rationale: epoetin alpha increases red blood cell production and can dangerously elevate hemoglobin, risking clot formation. 31. A nurse is caring for a patient prescribed prednisone. What side effect requires immediate action? Answer: signs of infection such as fever or sore throat. Rationale: prednisone suppresses the immune system, increasing the risk for serious infections. 32. A patient receiving tamsulosin complains of dizziness when standing. What is the nurse's best advice? Answer: instruct the patient to rise slowly and sit if dizziness occurs. Rationale: tamsulosin can cause orthostatic hypotension due to vasodilation. 33. A nurse administers alteplase to a patient with a stroke. What is the nurse's priority assessment? Answer: monitor for signs of bleeding, especially intracranial hemorrhage. Rationale: alteplase is a thrombolytic agent that significantly increases the risk of bleeding. 34. A patient on methimazole for hyperthyroidism develops a sore throat and fever. What should the nurse do? Answer: notify the provider and check white blood cell count. Rationale: methimazole can cause agranulocytosis, a life-threatening drop in white blood cells. 35. A nurse administering enoxaparin should take which critical precaution? Answer: do not expel the air bubble from the pre-filled syringe before administration. Rationale: the air bubble ensures the full dose is administered and prevents medication leakage at the injection site. 36. A patient receiving oxytocin for labor induction develops late decelerations on fetal monitoring. What is the nurse's immediate action? Answer: stop the oxytocin infusion and notify the provider. Rationale: late decelerations indicate fetal distress. Stopping oxytocin improves oxygenation. 37. A nurse prepares to give a child acetaminophen. What side effect must be emphasized to parents? Answer: risk of liver damage with overdose. Rationale: excessive acetaminophen can cause hepatotoxicity, which can be fatal without timely treatment. 38. A patient on diltiazem for atrial fibrillation reports dizziness and fainting spells. What is the nurse's priority? Answer: assess heart rate and blood pressure immediately. Rationale: diltiazem can cause bradycardia and hypotension, leading to decreased perfusion and syncope. 39. A patient starting lamotrigine reports a new rash. What is the nurse's first action? Answer: instruct the patient to stop the medication and seek medical attention. Rationale: lamotrigine can cause Stevens-Johnson syndrome, a life-threatening skin reaction requiring immediate discontinuation. 40. A nurse is teaching a patient about rifampin therapy. Which statement by the patient indicates understanding? Answer: I understand that my urine and sweat might turn orange. Rationale: rifampin can discolor bodily fluids. Patient education prevents unnecessary alarm. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.